This PowerPoint focuses on the technically challenged and the accountability, the ethics, and the legalities involved. My name is Rachelle Nash. I am an Indiana State University nursing student in class NURS 444, and I will be discussing the population at risk, or PAR, of the technically challenged adult population. At this time, I will pause for a brief moment so you can take the pretest. Good luck. The topical content includes learning objectives. What is telehealth? Discuss COVID-19 and technology challenges. The healthcare role in regards to family practice and behavioral health. Promotion of technology, assistance, and the ethical and/or legal aspects. And then upholding ethical principles when using patient care technologies. Finally, with the resources. The learning objectives are: evaluate different reasons one may be technically challenged, recall at least one way to ease the transition or assist in aiding a technically challenged person, name one major factor making learning technology important, and explain what a telehealth visit means. What is telehealth, you may ask? Telehealth involves a remote transaction between a healthcare employee and a patient. COVID-19. During these times of COVID-19, those who are technically challenged are at a disadvantage. We are using a wide array of technology in the United States right now, from doctor's visits to grocery shopping. Those who are hard of hearing are having difficulty hearing friends and family over the phone, or trouble understanding what a provider may be saying during a telehealth visit due to the wearing of masks since they cannot lip read. Many people in my community of Brown County, Indiana, lack cell phone service as well. As a healthcare employee, it is my duty to reach out to my community and assess the areas in need. I put the power in the hands of the patient and ensure they have the resources needed. Behavioral health care. Due to a shortage of behavioral health care providers who can prescribe medications for patients, such as a psychiatrist, telehealth visits are not a brand new concept for many patients. I have encountered several patients who come to my office for a telehealth visit with a provider in a different state, because here in Indiana there are just not enough psychiatrists. When this process occurs, I obtain the patient's vitals and assist them with completing a mood screening questionnaire. Then I populate their information in the computer and ensure they are not having any technological issues prior to providing the patient with privacy for their meeting with the psychiatrist. This type of telehealth is relatively new in the rural area of Trafalgar, Indiana, which is right next to Brown County, Indiana. But at least the patient has resources in the office for the assistance as needed. Smartphones, instant text messaging, photos. One ethical or legal concern involves providers using their smartphones for personal and office use. Morris, Scott, and Mars discuss how this is impractical. It is the company and the provider's job to be knowledgeable of the apps used for healthcare on their phones and to ensure security measures are in place. At my place of employment, the providers are able to take a picture of a wound on their smartphone. Then they upload that photo into the patient's progress note from the app our company uses, or the medical record system that our company uses. It is important for continuous monitoring by our IT department to reduce the risk of any HIPAA concerns, as well as for the providers using the software to be knowledgeable and stay up to date. Patient care technologies. At this time, we do not offer group telehealth sessions to preserve the ethical principles of our patients in family health care. I do know that group services are offered through some telehealth aspects, such as AA classes, but not in the primary healthcare setting. Upholding ethical principles when using patient care technologies. The ethical principles in nursing include justice, which means being fair, benefits, acting on the right thing for the patient, non-maleficence, doing no harm to the patient, accountability, as a nurse being accountable for one's own actions, fidelity, keeping one's promise, anatomy, respect the rights of the patient, and veracity, being truthful to patients. Justice and benefits. To be fair in the healthcare realm, it is important for nurses to provide an opportunity for all in the community to have access to healthcare, even during the times of COVID-19. I am practicing benefits by triaging patients and directing them where needed. I have been working in the community, standing at the door of my facility. For those who do not have a smartphone to use, I offer them a regular phone call with the provider, even though they cannot see them face to face. For those with respiratory symptoms, since we cannot see them in the office right now, per my company's protocol, I offer them the address and phone number to the closest location that can assist them. Non-maleficence, accountability, and anatomy. As a nurse, I focus on helping patients and our community. That comes with respecting the patients and being a patient advocate, keeping communities and families safe from harm. We have been collecting canned food for families in need during these COVID-19 times. We also inform patients of places to go for assistance while respecting the patient's wishes. Fidelity and veracity. Keeping promises and being truthful is very important during the times of a pandemic. Patients need to be informed despite the fear that a pandemic such as COVID-19 comes with. Many people fall into depression. My family and church family are helping a single mother of a Down syndrome baby this week paint her home, as the child has tested positive for lead. We promised to help her as a community effort and have kept that promise. That is what makes our community strong and trusting healthcare employees. I have attached a couple resources. The windrosehealth.net can serve as a resource for education and assistance when seeking a telehealth visit or utilizing the technology. That is the company that I work with. And then for further information regarding one's privacy with telehealth, you can also visit the following website that I have attached there. You can now take the post test if you like, and there is an answer key attached as well. Thank you.